it's really important that we get access for these agents, these radioligand therapies earlier in the disease for really two reasons. One, I think obviously is, patients are more likely to respond to the agent earlier in the disease setting. I mean, eventually there's going to be more higher volume disease, more likely there's going to be kind of heterogeneity in the expression, delivery, and resistance to this therapy. So earlier, lower volume disease gives us that flexibility to potentially see, deeper and more durable responses in a higher percentage of patients. But importantly, there's a lot of patients that really are not candidates for chemotherapy. And so when we think about the trials in sort of the earlier disease state, it's not pre-chemotherapy, it's chemotherapy naive. Because probably half of those patients are really destined not to get chemotherapy ever for other health concerns and whatnot. And so just recognizing that these label expansions are going to open up a population of patients that wouldn't otherwise be able to get the drug at all. So that's really important. And I think the other thing is to recognize that, we're going to want to understand more how to integrate this with other therapies, particularly our hormonal therapies. And there's a really important study called PSMA addition, which is looking at this in the metastatic hormone sensitive setting. And I think we're going to see other, therapies in that space as well. But this is an opportunity really in the early frontline setting of hormonal therapy to combine Pluvicto and I think the jury is out with just how much of an impact that can have. It's difficult to assess these when we're going against active comparators like active hormonal therapy, but it's really important to recognize that therein lies the opportunity for real synergy. Every study that we've done so far with Pluvicto outside of that has been in the setting of resistance. So Vision was done after a patient had failed therapy and got Pluvicto alone. PSMA-4 was done in patients that had progressed on an AR pathway inhibitor and then got Pluvicto monotherapy, or maybe they kept their AR therapy going, but it wasn't as effective. PSMA addition is really the first phase 3 study to really look at Pluvicto in the context of other active therapy, real synergy. So that to me is sort of like a new sort of breakthrough if we see real advantages there, and it opens the door for other future combinations as well.